going through and seeing who's on, then we'll do roll call. All right, let's just go ahead and do roll call and see who we have. A little worried about a quorum. Whoa, what happened there?
I counted 4 of you as you logged in.
Okay. Lost my screen, but that's okay.
We have 5 now. I
Okay.
have Steve, Van, Evan, Brandon, and Kristen just logged in, and it looks like Kevin is also logging in.
So that gets us to 6.
Yes, sir.
The quorum is going to be 7, right, Aaron?
Yes, sir.
Let's go ahead and start. If we show up, we'll come back and do the minutes at that point. If not, we could do that later on. Leslie Hoffman, DMS update.
I am on.
Hey, how are you?
Fine, how are you? So I'll give you a couple updates, and I've also asked Leanne Fitzpatrick to give you some additional information for stats and related information. So as far as the SUD 1115 waiver amendment, as you've heard me say before, we're in the midst of renewing our Kentucky 1115 authority, and that is set to expire on September the 30th. We have to request an extension 1 year prior to the end of the demonstration, which would be this September the 30th. So under that authority also falls that waiver amendment that we did. We can have it waiting in queue. We can mention it in our renewal, but they've told us that nothing will be approved until they get the big 1115 umbrella authority approved. However, we have been working with them diligently on our budget neutrality and working with DOC as a partnership to get that budget neutrality workbook completed. We sent it to them last week for their review. We actually had a meeting scheduled, but they asked if they could just have it for review first. So we're hoping to start discussing that in our monthly meetings. I think that's it. We're pretty much just working through, I almost feel like it's the negotiating period with CMS when you're working through budget neutrality. So I do think this is a very positive thing that we're working towards and getting that workbook submitted.
Okay, so September 30th, the renewal will be submitted.
We have to send in a, they call it an extension. It's actually not a renewal. It's an extension of the demonstration for the big 1115. And that has to be sent in 1 year prior to the demonstration ending. It ends in, I'm sorry. It ends in 2024. Therefore, our request for the extension has to be sent in September the 30th of 2023. So everything's kind of getting tied up into that renewal. They said we can't have amendments waiting in the queue. This one's a little bit different because it's already there. So other things that we're working on, they said, you know, we can go ahead and submit, but it will not be approved until the 1115 authority is approved, if that makes sense.
So does that mean we have a year to wait or 2 years?
Well, the umbrella authority is, it's not set to expire until the 30th of 2024, but we have to submit the renewal or the extension 1 year prior. They've not really given me.
Wait, 1 year prior, wouldn't that be 23?
Yes. So 2023, September the 30th of 2023, we have to request and send in for the extension that is set to expire on 2024. Does that make sense? Sorry if I said that confusingly.
I'm a little confused about the SUD status then.
So it's there now, but they've not said anything about approving it prior to the umbrella authority of being approved. They said that we can have those in queue, which means ready to go, but they've not said anything about whether they would approve it. They can't approve it prior to the renewal of the umbrella. Now, it might not take them that long to approve the umbrella. That's what I'm hoping. And I keep referring to it as an umbrella because it gets very confusing. So if they can.
Again, that's not submitted till a year from September.
No, September of 2023.
We're in 22 now.
Oh, I'm sorry. I'm sorry. Yes, I'm sorry. I've been saying it wrong, haven't I? I'm sorry. Hang on.
Thank you.
I'm sorry. I'm confusing everybody. So our
So
authority
the
is set to
extension
expire.
is 9/30/22.
Yes, I apologize. I keep saying that wrong. I'm sorry.
It's okay. I was gonna say, we're talking about this waiver
Oh,
and
goodness.
You were worrying me, Leslie. I thought.
No, I apologize. I was just saying the year's
yeah,
wrong. Lots
I
going
saw
on.
Van's
Lots of
face get a
dates.
little anxious there. Okay.
I apologize. Yes, I'm sorry. Yes, you're correct, Steve. It's 2022.
Okay.
Thinking I'm working towards 2023 because we're already in the fiscal year 2020.
Right. I understand. I get it. I get it. I get it.
So yes, so September the 30th of 2022, we have to request the extension of the big umbrella 1115 that is set to end on 2023. I apologize. Yes. So our amendment, of course, is sitting there in queue. And we're currently working on the budget neutrality. So it's not ready to go yet, but we do feel like that is very hopeful that we're working through that
Okay.
budget neutrality with them. And then Leanne, are you on?
Yes, I am.
Can you go ahead and give your updates and watch your dates like I
Well,
did?
on that topic, I think one of the challenges the TAC has is we're all waiting for this waiver,
Yes,
right?
yes, yeah.
So, we're trying to engage ourselves and do stuff, but really
Yes.
the reality is, I think when that switch is thrown, there'll be a lot more specific issues to address in the rollout.
Yes, sir. Yes, sir.
So now, is Leanne at the beach? No. So I think that's part of, the challenge of keeping people engaged in this TAC
Yeah,
is right now there's some things to talk about and do,
Yeah.
but it's really this big thing we're waiting on. And,
yeah, us too. And we were hoping, we went ahead and scheduled the meeting to discuss the workbook with them, but they asked us not to do that and to keep that separate and that they would go ahead and review it. So we sent it in last week, and then we're hoping that we can discuss maybe in our upcoming call, the end of this month, I believe it is.
Steve, they came up with a really good workaround for us to do MOUD behind the wall and pay for it. I thought Leslie was very innovative the way you all went at that, and came up with a way to just to increase the weekly stipend enough to where it will cover those individuals who are active with MOUD before they leave the prison.
So when we went back and looked at our workbook and changed the thought process of comparing it, because originally we had a process of how we were going to complete the budget neutrality based on if someone was in residential care, for example, and then CMS asked us to go back and relook at that and gather DOC data, but DOC data is not really comparative apples to apples when we're talking about funds to cover services. So we've gone back now and trying to look at it as more of a cost efficiency. So we're looking at other ways that we might enhance that amendment, which is very exciting, and more to come on that later. But yes, we're trying to be on all the amendments that we're making and trying to draft right now. I'm trying to be as innovative and as can possibly be and meet as many needs as we can. Go ahead, Leanne. I'm sorry.
Well,
Oh, no.
before we move on, I just want to make sure that I understand kind of where things are at this point. So my takeaway from this is that we have no reason to think that between now and September 30th that we're going to get any type of decision from CMS on the SUD waiver. And then even then, we don't know when it's going to be after that. Is that the basic takeaway?
Yeah, so it's an
Good question,
amendment to
Evan.
that big umbrella authority as part of the problem. And it just so happened that it's time to renew that authority. It's a 5-year authority. You have to ask for an extension. Sorry. You have to ask for an extension 1 year prior to, so we're kind of getting mixed up into that timeline, unfortunately. And it's not just with this amendment, it's lots of things I've got that I'm working on right now. We're not sure how long it will take them to approve the big umbrella authority, and we're not sure how much longer it's going to take right now. Like I said, I hope that we can get to a point that we can discuss the 1115 amendment the end of this month. So they waited 14 months before they even reached out to us. So
Right.
it wasn't an expected delay on our behalf. Of course, we are the first in the nation that's trying to ensure that these services are covered. So
Based on
Okay.
your experience, Leslie, how long does the 1115 umbrella usually take to be approved?
Well, they usually ask for a year for good reason. So I can't exactly tell you that right now. We have had, I think the previous 11 SUD amendment took, it was over a year. What was it, 2 years? That
2
was
years.
prior to me coming back. So we're hoping that that's not what that means, because this is the extension of the
Right.
existing.
So it's not new stuff, it's continuation more or less,
Right.
or mostly. Yeah,
Okay,
I just
Leanne.
think we've all been waiting on this for so long that it's,
Yes.
We have been too. We're like, this is something we're very excited about. So yeah, because I want to move forward. I want to take a look at DJJ confined population. We've also
Right.
talked about the mental health population, and
Mm-hmm.
we're ready to move forward. So
yeah. And folks who have been released, right, returned, haven't had the benefit of this to date. And, what's the consequence for those individuals?
yeah, the only thing that's been beneficial, of course, Leanne's worked with the reentry program, and then the APRA system has been beneficial into shortening some time. I think that legal ice is over, but yeah, they've not benefited from this particular
Right.
amendment. That's correct, Steve.
Okay,
Right,
well,
Lynn.
my background is through Zoom, so if you'd like to have that for your background, you're welcome to. I'm going to put in the chat my numbers for reporting purposes, but as of the last report that I had received is July 5th, the total Medicaid population, as you can see, is over 1.6 million, and total incarceration is almost 20,000. So our reentry program, we are not meeting monthly like we used to. The process is still working like it is. New members are updated. We have communication channels everywhere, and we are seeing more suspensions released closer to release date, so that benefits can start on that release date. That is still growing with that APRA's inputted into the system. Release dates are the release, and the majority of them are within 3 to 5 days of the benefits being turned back on. So that's a lot better than what we saw in the beginning of 3, 6, 9 months or to a year.
Yeah.
So, and we did have a couple in our last meeting with our MCOs, our behavioral health operations meeting. There is some success stories about the reentry program working, where the MCOs may not have gotten with them at release, but have contacted them through the parole officers or through other means of getting the GSC of getting contact information and working with them and getting them set and stable and part of the working back into the community. So the program is still working, it's still going, and we're just proud of what we have accomplished with that.
Any questions?
Okay, thank you.
The Medicaid population, the public health, is there going to be a drop off? Are people going to be impacted? I think presumptive eligibility, does that change? And that will impact folks who are returning that way?
So we will have an unwinding period that we're working on now. I don't know how, Lee, are you on? May I ask you?
I don't think she
There we
is.
go. Yeah, I am.
Is
I
she
There
am
she
on?
here.
is. Sorry,
I
Lee.
thought I saw her name. Yeah.
I couldn't find my unmute button. The public health emergency is current, has been renewed, or will be renewed until October the 15th.
Right.
And we have a plan to unwind, certainly at that point. When the public health emergency and presumptive eligibility changes only in one way, and that is that it will be only one period of presumptive eligibility allowed per calendar year. During the emergency, we had a waiver to allow 2 per year.
And Lee, how long is that period?
Up to 60 days.
Okay,
Right, right. So it's good for the month you apply plus 1 month further. It can remain in effect if you have applied for regular Medicaid and the application is still pending. So that's the only reason for an extension of that. time
Hey,
period.
this is Dr. Smith Stevens. I'm just letting this party coming in, but I'm here now.
Good morning.
Good morning.
So
well,
scuttlebutt is that and I mean scuttlebutt, it's entirely rumor that the public health emergency will last until 2023, so that we won't likely be unwinding until 2023.
okay.
Okay.
So, I mean, obviously, hopefully that gets extended. I'm concerned of people who, because I guess coming out of incarceration, we're assuming they're going to be Medicaid eligible, right? I mean, based on income, right?
Right.
And they would then have 60 days if this does go into effect to become eligible, right?
Well, people who are incarcerated can apply and become eligible while they're incarcerated for traditional Medicaid. They just are not assigned an MCO and they don't have access to benefits. We encourage that so that, perhaps you can become eligible faster or get access to your benefits faster once you are released from incarceration. But yes, if an incarcerated individual is released and they apply for presumptive eligibility, at that moment, they would have up to 60 days.
Okay. I think this is going to be really confusing for a lot of people, right?
Sure.
All right. And are those folks making applications now while they're incarcerated? Does anyone know that?
Yes, they are.
Okay.
I can't remember, 2 years ago, maybe now, they did applications for everyone that was incarcerated. And the application is added at booking so that is completed with all their booking paperwork. And then if a part of the process with our reentry program, that if we're looking at also not only who was released, but looking at 6 months out, who is potentially to be released within 6 months out. And those names are given to our connector. And once that they're able to go back into the facilities, they will have a monthly release date or pre-release class for those incarcerated, and will complete applications at that point as well. And then if someone is released and they don't have an application, the connector is notified so that that's priority. And DCBS still has that as priority, that those applications are processed.
All right. Good deal. Any questions? Again, we're all eagerly anticipating. Have some real things to talk about. I think we now have a quorum, right, Aaron?
Yes, I believe we have 8 on.
Okay, good. That meets the standard. So can we go back and approve the minutes from the May 12th meeting?
Yes,
Got a motion. Do we have a second?
Second, Brandon Harley.
All right, thank you, Brandon. All in favor, signify by saying aye.
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 Those
Aye.
opposed and abstentions. All right, that work's taken care of. Thanks for that Medicaid update. I think it's good information. The next thing I have on the agenda, and I've had some conversations with folks recently. I don't know if this fall under our purview, but it's going to now. We've had problems hiring folks with previous felonies and misdemeanors For example, Leslie, I mean, the SEL waiver precludes a lot of folks, right away to work in a staff residence, a group home or something like that. And it's become more of an issue and it's been compounded, I think, with the staffing challenges we're now seeing as well. So I guess what people have asked me about, are there specific Medicaid or cabinet policies that impact the hiring? And obviously, if you can't hire folks, the reentry piece, right, Kristen, is going to be profoundly impacted. And she's shaking her head vehemently less. Yeah, she's probably lived through that much more than I do. But just so you know, I think that's an issue. And again, I've been here meeting with folks at mental health centers for too long to count. This issue has come up significantly, regularly in the last 90 days. And I think more people are seeing challenges when they get a candidate, and we go on from there. And I've told people, if the misdemeanor or the felony is relating to substance use disorder, you can set up a mechanism, right, to test and screen and figure that one out. I talked to employers years ago. You can do the same thing. We can hire somebody and we can do a intensive outpatient program at your location for this person. And you can test them, and make that part of the condition. And I think most folks would say yes to be able to work. Kristen, is that your experience as well?
Absolutely. And I'll tell you just a couple of things in the employment realm that we have currently in DOC. So for anyone who is not familiar, we have received, and this started probably 3 to 4 years ago, we received funding through CORE, Kentucky Opioid Response Effort, to employ reentry employment program administrators. We have 11 of those throughout the state, and their sole job, so they are DOC staff, their sole job is to get our population hired, get them a job. So 80% of their job, they do person-centered assessments to where they will sit individually with the offender, see what experience they have in the workplace, see what education level they have, all of those things, and then pair them with a job basically in the community. The other 20% of their job is they literally knock door to door on businesses and explain basically our population, the pros of hiring them, and then also federal incentives as the bonding program, things like that. So their job has been really, really huge for the department. And they, as of the end of 2021, have a 55% success rate. So it's the only program in the Department of Corrections to where we have that good of a success rate. So of being able to meet with someone and get them a job, they are very successful. So we have that.
55% of the folks they work with are employed either part-time or full-time?
Yes, get employed either part-time or full-time as a result of their assistance. So they have huge, huge success. And like for 2021, for instance, I've got the numbers on the board behind me, so that's what I'm turning around. But for 2021, they met with 3,178 individuals. So they are meeting with thousands of people each year to get them employed. And then constantly going door to door in the communities, trying to get more and more employers to sign up. One of the things that we just started July 1st, so we're 2 weeks into this new program, so I was kind of excited to say it out loud today, is working in a partnership with the Chamber of Commerce with a program that we're calling the Employment Pipeline. And so what the Kentucky Chamber of Commerce is doing is they have businesses who have been coming to them, knocking on their door saying, we can't hire anyone. So they are saying, okay, well, you can't hire anyone. Are you willing to be a second chance employer? Will you hire the justice involved population? If so, then they are telling me and my staff, hey, Joe's shop down the street, they are willing to hire your population. So what we have started doing on DOC side pre-release is there's about 8 fields that the chamber was seeing that they were really, really needing people to work in, construction, welding, day labor, like different things like that. So in those 8 fields, we are talking and surveying the population pre-release before they get out of custody to figure out what experience they have in working in any of those fields, and if they have an interest. If so, then before they even get released, we are going on connecting them with that REPA that I have in the community, who is connecting with that local employer and saying, okay, listen, Kristen is getting out of custody in 2 weeks. She will be out with her state ID. She will have that. She will be able to start the job the next day, and going on and making that pipeline happen. So we just started that July 1st. So we're going to, of course, capture numbers on that and see the success of that. But thankfully, at the department side, we are seeing more and more businesses starting to be willing to hire our population. So that is something we're seeing. And whether it's becoming, whether it's for the fact that people are becoming more open-minded, or if they are desperate for employers, I don't care.
Yeah. I tell people, as long as the check clears.
Absolutely. As long as you will help my people that we have, then I don't care what the reason is. But it is definitely growing. But I do think that, the state as a whole, we can definitely grow more in that area for sure.
My experience has been, we have some programs where we treat people, we see people, we support recovery in one part of our business. I mean, another part of our business, they can't hire those people.
Yeah.
And that's not our choice. That's a regulatory requirement. So it is a little bit frustrating.
Absolutely.
And you other folks who have a misdemeanor felony that we can't hire either, but for other reasons.
Yeah.
So I just think it's something we need to pay attention to. Leslie, will the 1115 having a supported employment option?
We're looking at an 1115 supported employment option on the SMI-SED side right now. So I feel like eventually all these different amendments will start coming together to make, and because they're all in pieces right now, right? But maybe some of those things might start meeting together. As you're aware that when we applied for the SUD 1115 on the incarceration side, I immediately had folks saying, is that something you could look at for mental health as well? So, and we're going to, if we can just get a little bit further, but yeah, we are looking at two options on supported employment side, Steve. And I think I'm going to have a meeting with you later. We're looking at supported employment on the SMI-SED side, as well as revisiting a 1915C type of option. So I'm just going to share that with you.
Thanks. And even with, I think this population, supported employment would be fun, would be different.
Yeah.
It wouldn't be, I would hope not as long. And it may be more like Kristen's doing now, a job placement piece.
Yeah, I love
Job
Kristen's
search and doing
idea.
that.
I love that. And I know that finding employment once released is so very important as part of, it's that whole social determinants, right? You need housing, you need to be able to pay for it. You need a job, and maybe some medical needs that have been let go. And so I know how important that is. And I love that idea. I think Voc Rehab would probably, I think they would still follow their avenues to help with assistance with employment too. I don't know about a provider getting paid though, Steve, because 1915Cs do have limitations on charges or active treatment.
Yeah. I'm just trying to figure out, because I think there's a piece of that. And
yes, I just wrote it down to follow up on it because I do love that idea. And maybe that's something very innovative we could take a look at in the near future.
Kristen, yeah, I had a couple. Now, what's the name of that program, or what are those 11 employees, their job title, one more time?
The staff that I have there, we call them just abbreviated REPA, REPA. They are Reentry Employment Program Administrators.
Okay. And are those, are inmates at county facilities also eligible for that assistance, or is it just at the prisons?
So the inmates that get out and they are on supervision with the Department of Corrections in the community, they are eligible. The REPAs help them as well. Now, what I will say on the pre-release portion side of it, when I was saying that the pipeline we just started July 1st, I only have funding, and not because of state funding, because thank you, Van, and also because of CORE, I only have funding for 7 jail reentry coordinators. Well, as we know, there's 70 plus jails throughout the state. So 7 people and handling all releases from those don't equate. So I definitely need more of those positions at some point. If anyone has money in their pocket and wants to throw it my way, I am willing to take it. But the ones that come out of those jails that we have assigned, we are covering 19 of the jails with those 7 positions. The people that come out of a substance abuse program from that, we are providing that employment pipeline service to that population. So we are hitting some of the jail population with that program, with these new positions, but not the entire jail population. But if they come out and they're in the community and on supervision with DOC, everyone can see the REPA.
Evan, would it help you to have that list of 19 jails?
I was thinking that, but I didn't
I
want to
can-
make Kristen.
I know,
rattle it off.
Evan, I will give you all of our maps. I will send you, actually, Steve, if you don't mind, I'll send it to you, and then you can
Yes.
send the whole group. I'll
Yeah.
send you the map where our REPAs, what areas they cover, and then our jail map as well.
That sounds terrific, because it's, again, as Leslie was saying, this is such an important part of, helping people, get out and stay out. And I'm
Absolutely.
glad that you all are doing that.
Yeah, thank you.
Yeah.
Now, we talk about it a lot that, all of our Class D inmates and our C5s are in county jail by statute. And we provide them very little service compared to what we do for folks who committed more serious crimes, which is kind of perverted system where if you commit more serious crimes, we'll help you. But if you're just a minor criminal, you're on your own. It just doesn't make any sense to me, but
Yeah, and you may get a bigger impact with those minor folks, right?
I think the people we could impact the most are
Yeah.
the Class Ds. But there's only so many dollars to go around, and we just can't.
Kristen, this is Leslie. Would you send Leanne and myself your information if you don't mind?
Absolutely.
Thank you.
I have a question on the 55% success rate. Are you analyzing that? Like, has the program been around long enough to have any trend analysis?
So I do know, and Van, I don't know if you can add on to anything I'm getting ready to say. I do know that CORE does some data analyses. I am definitely not the person that can really speak to that. All we do at the department level is I track and look at how many people that they have seen, and after they see them, are they sending them to an education referral or a direct employment referral? Sometimes it's both. It also, so one person can have both referrals. And then as a result of that referral, do they get employed? And so that's all that I'm tracking. I would argue till my face is blue with anyone that when you look at the lowering recidivism rate in the Department of Corrections over the past several years. So this past year, we released a 29.17 recidivism rate, which is an all-time low. It's amazing. So let's go back to 2017, 2018-ish, we were in the mid 40s. So just in those few years to see that decline, I would argue till my face is blue that employment is a huge factor in that. Being able to get this population a job and help them become tax-paying citizens and not have to steal for their families, all of those things. I think that has been one of the very impactful factors of lowering that recidivism rate. So beyond that, I know, Adrian, that was a really long answer of, I don't know beyond that what CORE studies. So Van, I don't know if you have any more information on that.
No, I know Dr. Marks does, but I don't have those numbers off the top of my head.
I just wondered, if 55%, if it represented an increase in successful placements or a decrease, or is it about held steady since the CORE program has been operated? Yeah, just some context.
It's probably a little bit of a decrease since the program started. We started with 3 or 4 folks that were really super motivated and really did amazing work right off the bat, to the point that Stamps just said, why don't you double this program? Because it's so successful. Well, as you make it bigger and involve more people, it becomes
Right.
difficult to keep those same success numbers. And so I think it probably has been somewhat of a small decline, but that's not anybody's fault. That's just by taking on more clients, you know, the numbers kind of get skewed.
And
Absolutely.
is there data at 90 days of employment, 180, 360, or?
We have not tracked that at the DOC
I don't
side.
know. Yeah, I don't know that Core has either, Steve.
Yeah.
I'll ask Dr. Marks about it.
Yeah. I used to do job placement for a living, and I always argued the job is great, but what happens at 180, 360? You know?
Absolutely. Yes. Agreed.
Kristen, this is Leslie. The only reason I mentioned Voc Rehab earlier, and this might be something that you're not even interested in. I was wondering if they would partner with you for you to help obtain and maintain the employment for the member, just like we would do through supported employment. It was just a thought. I'm sure they get asked to help with placements. They oftentimes reach out to other providers like the CMHCs to assist with placement, for folks who have mental illness and or the IDD population. So this is another population that needs to be addressed. I was just curious if they might be interested in partnering with you on that and using your assistance. Just a thought.
And I'll tell you, Leslie, I would say that our REPAs probably have connections with some of the Voc Rehabs throughout the state, but I don't know that there's every single person has a connection with them and it's a formal like process or anything like that, because they will reach out to a lot of community entities to help make this the offender's success. So they'll, they reach out to career centers, everything too. So,
and I'm probably thinking way ahead. I was just, if they could utilize a program like yours, though, to make those placements, they pay you to help obtain and maintain the employment and do the follow-up work. So I'm like Steve, I used to be a supported employment coordinator too, but I was just thinking that would be
I guess we have to find out if this population is an eligible population for Voc Rehab. You would hope it would be, obviously.
Yeah.
So pre-COVID, we brought all the employment people we could think of together in Lexington for a summit so they can kind of network with each other. It's probably time to revisit that.
I think so too.
I agree. That's what I was thinking. If it's not a possibility, can we revisit that? Because this is such a hot topic and a hot need in Kentucky. That's what I was thinking. Well, why wouldn't you try to connect with them and for sustainability of your programs? It's just, it's a thought.
Yeah, I've got the money to do that in 23, so we'll look at figure that out for the spring.
Okay. And I don't mind to be involved if you want to invite Leanne and myself on that one. That'd be fine.
Absolutely.
Yeah. Very good. Any other things about employment? Work's a good thing. Round robin member update. Anyone want to give an update?
I'll just mention two things real quick, Steve. Recovery Ready Communities.
Yeah.
We partnered with Volunteers of America to implement that program. We plan to have our first draft to give to our commission third week of September. Senate Bill 90, I think that's the bill that identifies 10 communities to do treatment for those that are assessed properly within 72 hours of arrest. I think the counties are going to be identified this week, maybe today or tomorrow. And then we're going to have our first implementation meeting on August the 11th. So we're working with AOC to get that project off the ground as well.
Good. I submitted 2 names. I was delinquent in my submission.
Yes, you were. I told Heather to tell you to get on.
I know. I'll own it. I'll say before you could. So yeah, that's a good thing. You want to talk briefly about the Attorney General's meeting, that commission?
Yeah, so the Opioid Abatement Commission, just to update everybody. So the settlement with McKesson and Cardinal Health and Johnson & Johnson was $480 million. 240 million of that goes directly to communities. We don't know yet what communities are going to receive money or how much they're going to receive. I'm told that CAECO and League of Cities are working on a formula to figure that out. So as soon as we have that, I'll share that far and wide. We have talked to League of Cities and CAECO to offer technical assistance for communities with Dr. Marks and myself to identify evidence-based promising practices, things that we believe communities can do. You know, you get one shot at this. We hope everybody spends the dollars wisely to impact the community. The other 240 billion or so goes to an opioids commission that it's staffed by the Attorney General's office. Brian Hubbard is the director of that. We had our first meeting day before yesterday. We're going to have 4 more business meetings and about 4 or 5 listening sessions where we're going to go to Pikeville and Hazzard and Owensboro and some other places and listen to folks. No grants or no spending of money before January 2023, which I appreciate the deliberateness of this process. Dr. Marks and I both gave a presentation on Tuesday to let the commission know where we're already spending money. And the takeaway from that is, you know, I fund a lot of programs, Dr. Marks funds a lot of programs, but none of them are to scale. None of them are statewide.
Right.
And so that was kind of our message to the commission. If you want to look at scaling some of these, here's some things we're doing that we think are effective. But we'll see how that works out. But I do appreciate the deliberateness of the committee and not just running and spending money before you figured out what the best thing to do with that is.
Yeah. And it'd be interesting to get the cities and counties to look at employment from their perspective.
Yeah. I'm really anxious, Steve, to learn who's getting money and how much.
Yeah, sure. You should be in those meetings between the cities and the counties, right?
Yeah. Dr. Marks and I have asked to speak at their conferences. I think League of Cities in September, CAECO's in November, and so we are going to be on the agenda to their members. Yeah.
Good. Good. Because I think some of those folks need education about, you know, beyond just what they hear about the opioid problem, right?
That's right. You know, they're not paid to be experts in this.
Correct.
Yeah.
Yeah. All right. Thanks, Van. Anybody else?
Yeah, I'd like to introduce my coworker Casey, and she can give a brief update to some of the services that at Apple Red Legal Aid we're providing to incarcerated people here in the kind of Floyd and Pike County areas.
Hi, everyone.
Casey, how are you?
I'm fine. How are you?
Good.
So just to give a brief update, our program is mostly with the Floyd County Jail. And I have a resource coordinator who goes in and he screens every individual who comes to the jail. We meet with the females together, but he screens all the males, just seeing what they may need, basic things, you know, everything from a birth certificate to if they have housing needs. And then he also screens them for any legal issues they may have that I can assist with. So then I go back and I meet with them and see what I can do to help them both while they're incarcerated or once they're out, because I am limited in some of the services I can provide while they're incarcerated. But a lot of the times that if they need a divorce, it's something I can help them do on their own, or we've been having divorce clinics in the jail where it's all self-help and we sit down and fill out paperwork with them. We have helped people get to homeless shelters when they get released, finding someone to post their bonds and then getting them a ride to the local homeless shelter, and trying to coordinate with rehabs to get them in. So we try to work with the public defenders and you know, just anything that they may need, holistic, you know, full picture, even signing up for benefits. We have someone right now who just got out of rehab and walked into our office, and we're helping him get on food stamps. So just wanted to, spread the word. We're hoping that our program can grow and move beyond Floyd County. A lot of the people we work with are they get transferred, or they're from another county, but they're here because they got arrested here, something like that. So we are kind of organically growing it in terms of we follow them, but we would love to see this, get expanded beyond Floyd County, because people seem to enjoy having someone to talk to and share their problems. And a lot of times they have more problems that can be addressed that they never thought to mention because no one has ever asked them. So
Casey, are you funded under a COSAP grant?
we have a grant through, and Evan may have to help me here. It's the Chan Zuckerberg Foundation, I think. Is that right?
Yeah, it's mostly funded through a private foundation. I mean, we at Apple Red, we do have a COSAP grant, but that's not what the work that Casey's discussing is funded through. Yeah, so we've kind of got this started more or less as a pilot project using some private foundation money. But again, but that meant that we were limited to really just focusing on the Floyd County area. We couldn't, at Apple Red, we covered 37 counties in eastern and southern Kentucky, but we just had to pick one. And so, again, I would love to find a way that we could provide this through more of our service area. And also really, I think it's a model that could work even beyond our service area. Again, as we think about all the various social determinants that lead to the problems that we're all here to talk about, I think this kind of the legal and social work is a part of that. We know we can't obviously solve all of people's problems, health, employment, etc. But, to the degree that there are civil legal problems that, are one of the impediments, we're really glad that we're able to help with that. And also, just be a resource that can make sure that we're connecting people with the other organizations and programs that provide services that we don't hear.
Yeah, well, the reason I asked, we've been talking about COSAP reapplication here at Justice, and just wondering if that was part of that.
And one thing just to throw out there, when you guys were talking about the hiring people with felonies or misdemeanors, and all the bonds that are available to employers, Jenny Hampton with it's the Office of Apprenticeship Employment. I can't think of the exact title, but she actually got cards printed up, and you can request as many as you want. And it's just a little business card for to give to people. We hand them out to clients to take with them, and it's basically that they can pull it out of their wallet and show the employer, hey, these are all the benefits that you can get if you hire me. So she is a really good contact to have, because she's been sending them out by the thousands to all of us in our reentry council. So people have said they've gotten hired after pulling them out, according based on our meeting from Monday. So that's proven to be a good resource, and
Yeah,
she's only been
good to
doing
have
it for about
those.
2 months.
Really good.
I can put her email in the chat for everyone
That'd be
in
good.
case anyone wants one. She says just email her and tell her how many.
And Van, doesn't that sound like some potential Senate Bill 90 work?
Yeah,
I mean, as Casey was explaining what they're doing, it seems like that's part of the initiative, right?
yeah, absolutely. That's good stuff.
Hopefully, maybe Floyd County is one of those counties. If not, there's a resource, right?
Yeah.
People are doing it. Thanks for the update, Evan and Casey. Anybody else? Some things in the chat that came up, 988, the call, the mental health, behavioral health. Marcy's on, she's been heading this up. Marcy Timmerman, that starts Saturday. So on Saturday, instead of calling 911, people can call 988 and access behavioral health services in a crisis. And that's going to be rolled out nationally. So it's just not Kentucky, and calls will be answered locally. So 13 of the 14 CMHCs are answering calls, and the other one's going to be local anyway. So you talk to a Kentuckian, you don't talk to somebody in, some other place. But anyway, so that's a big deal. I think that's going to happen. We also had a request, it was in the chat, get some information about the funding programs, you got a list of programs that Van and Dr. Marks are funding. It's just a core PowerPoint probably, Van. Can you do that? There's a message to me, Van. You're muted, buddy.
2.5 years on Zoom, I still can't figure it out. Yeah, I'll send you the PowerPoint that Dr. Marks and I presented to the opioid commissioner earlier this week.
All right.
And you share that far and wide.
All right, very good. Appreciate it. Anybody else? This is a good meeting. Good information. We are scheduled to meet again September 8th. And Casey gave us her email address in the chat as well. Trying to write that down, ARD. All right, last chance, folks. And the information I get, I'll send to you as well, Leslie, okay? Anybody else? Going once, going twice. All right, good meeting. Appreciate y'all. Soon we'll have a waiver. We'll talk about that. That'll be better. All right, thanks for the good work on employment. See y'all. Bye-bye.
Everybody have a great day.
Thanks, Aaron. Appreciate it.
No problem. See you later.
Yep, bye-bye.